All right, so today I'm going to be covering the infectious disease process of Staphylococcus, MRSA, VRSA, Streptococcus, respiratory syncytial virus, and Clostridium difficile. Um, but before we begin going more in depth and talking about those diseases today, let's just take a moment to look at the 5 stages of the disease process. Now, these 5 stages are typical for the majority of the diseases out there, but this is not definite for each individual disease. So, stage one is the incubation period. This is a period where the infected person has the disease, but is not feeling the effects or not suffering from the effects from the disease. Second is the prodromal period. This is when the person begins to see symptoms such as a runny nose, you're sneezing, you're coughing, but you're not feeling the full effects of the disease at this point. Thirdly, is the period of illness. Now, this is the period or time when you actually begin to feel sick. Um, the effects of the disease begin to peak, and you're at the max effect of the disease. Fourth is the period of decline. This is when the disease or the effects of the disease begin to dissipate. You're still sick, you still feel the effects, but they're not nearly as severe as they are during the peak period. And then lastly, the fifth stage is the period of convalescence. Now, during the period of convalescence, you're recovering from the illness, but you're still weak. So those are the 5 stages of disease. Um, so just talking about the diseases that we're going over today, um, just remember that during any time during the 5 stages of disease, it's possible to spread the disease, and it's possible to pass that on to other people, family members, co-workers, so forth and so on. And it's important to remember as a member of the clinical support team that we must remember to try to protect those around us by making sure we're doing proper care, washing our hands, um, making sure that we're using sanitizer, going in and out of rooms, and proper hygiene just throughout the day. Um, so the first disease we're going to talk about is staph, Staphylococcus, or again in short for staph. Um, Staph is a wide family of bacteria that include MRSA and VRSA as well. Staph is present in the normal bacteria for the majority of people in the world and is located in the microflora of the skin, the mucous membrane, and the lower intestine. Although this bacteria is normally kept in check by the immune system, um, it is possible for those with suppressed immune systems, such as cancer patients, AIDS patients, elderly, and pregnant people, um, to be at greater risk for falling to the symptoms or falling to the effects of this disease. Um, Next, we have Streptococcus or strep. It's also a bacteria, it's an anaerobic bacteria that is parasitic to humans and animals. And strep causes various diseases that can range from a mild angina to deadly blood or organ infection. Similar to staph, strep is part of the normal flora of all organs and respiratory system as well as the gastrointestinal system. All right, so next we have RSV or the respiratory syncytial virus. Um, RSV is a RNA virus that causes seasonal diseases of the lower respiratory tract. Um, this is predominant in infants and young children who are at greater risk for falling to the effects of RSV. Um, RSV can be asymptomatic, or the person may face severe illness such as bronchitis or pneumonia. Okay, so next we have Clostridium difficile, or C. diff for short. It's a anaerobic gram-positive bacteria that is associated with diarrhea, pseudomembranous colitis. It disrupts the normal gastrointestinal function by producing toxins that cause inflammation and damage the intestinal mucosa. Okay, so just a little background on these diseases. Staph is spread through airborne, oral, or contact routes with an infected party um, or an infected surface. It is often spread during hospital stay. So again, that's why as a member of the support team, it's important to make sure that we're washing our hands, we're following contact precautions, we're covering our faces with masks, and taking care of proper procedures when dealing with people who have staph. Um, Strep is also spread via contact and airborne particles, and also due to poor personal hygiene um, for individuals. RSV is spread through airborne droplets and is most contagious during the first week of infection. And this is typically a time where a person may not even know that they are infected with the disease at that point. All right. C. diff is present in healthcare facilities, generally because when people are on antibiotics, the bacteria begins to rise. The number inside the body multiplies rapidly because the antibiotics kill off some of the other bacteria that kind of keep that in check, as well as when the immune system is suppressed. So therefore, C. diff has a rise when the person is on antibiotics. Um, Also, a person may come in contact with C. diff due to dirty or unsanitary bed linens, towels, furniture, and tools that have come in contact with C. diff and that have not been cleaned properly. All right. So next, we'll talk about the treatments. Uh, Currently, the treatment for staph is antibacterial drugs and select that are selected based on the biology of the type of staph that the person is experiencing. MRSA is treated with van- vancomycin, which Versa is resistant to vancomycin and has to be treated with other types of antibiotics. The outcome for an infected person is generally good. The mortality rate for people who have staph, MRSA, or staph is about 15%. The number can rise for MRSA, Versa, and other types of drug resistant staph infections. All right. So, strep is treated based on IV antibiotics in addition to drugs that may be prescribed in order to help the symptoms of secondary effects of strep. Strep may cause heart failure and sepsis. Recovery is generally favorable and it has a mortality risk as high as 15%. And that's typically in the case of sepsis. So, when a person has sepsis, the disease is spread throughout the body via the bloodstream, which at that point it becomes more difficult to treat. Therefore, the rise in the mortality rate. Okay, and currently for RSV, there is no treatment to prevent or stop infection. The only treatment available are supportive drugs to help alleviate secondary symptoms, such as albuterol for bronchospasms. The outcome for RSV is favorable. However, those who have RSV um, that are young children or infants are more susceptible to the effects and have a higher mortality rate due to their lower or weakened immune system just because they're so young. And lastly, we have C. diff. The current treatment for C. diff is antibacterial drugs that vary depending on the severity of the disease. Fecal microflora transplantation may also be an option for those who experience recurrent infection. Um, so if a person has C. diff, the C. diff is kind of treated. It's thought to be eradicated, and it comes back. Then at that point, they may have to do a fecal transplant where they take feces from typically, if it's a child, it'd be a parent, or if it's an adult, um, a spouse or someone that lives in the home with them, in order to get their flora back into a level that can suppress the C. diff. Prognosis is usually positive. Elderly patients may suffer relapses at a higher rate than the general population, um, and are more prone to again relapse when have reinfection. These people must be monitored both throughout treatment and also post treatment to make sure that the flora and the C. diff is kept in check, and if they need to be put back on medication, they can be made. The medical staff can be made aware of that without them experiencing severe side effects. All right. So again, as members of the medical team, we must make sure that we take care of ourselves, our patients, our family, as well as the population by making sure that we're just taking care of proper procedure and generally good hygiene, and that'll help take care of some of the spread of some of these diseases that we have talked about today. So again, thank you.